Let me ask you something. Do you sleep 7, maybe 8 hours a night, but wake up feeling like you barely slept at all? Your mind is foggy. Your energy is gone before lunch. And no matter how early you get to bed, you just can't seem to get that deep, restorative sleep you used to have in your 40s. Here's what I want you to do right now. Think about last night. What time did you eat dinner? What did you eat after dinner? Did you have a snack at 9? Maybe some fruit at 10? Some crackers or yogurt at 11? I want you to actually count how many times you put food in your mouth between dinner and bedtime. Go ahead, count it. 1, 2, 3 times. More? I'm going to tell you something that might surprise you. After 20 years of treating patients over 50, I found that the problem isn't your mattress, it isn't your sleep position, and it probably isn't sleep apnea. The most common sleep thief I see in my clinic is something that happens hours before you ever close. Your eyes. And almost none of my patients realize they're doing it. What surprised me most was that these patients were doing everything right according to standard sleep advice: dark room, cool temperature, no screens before bed. They were eating healthy foods, not junk. But they were still waking up exhausted. And when I started asking one specific question about their evening routine, the same pattern emerged every single time. That question was simple. When do you stop eating for the day? And here's what I kept hearing. Well, I have dinner around 7 or 8, then I get hungry around 9, so I have some yogurt because that's healthy protein. Then maybe some fruit before bed because I read that's good for you. Sometimes I wake up at 2 in the morning and have a small snack because I can't sleep when I'm hungry. This is what I call the evening grazing pattern. And here's the part that nobody tells you. Every single time you eat something, you're not just putting fuel in your body. You're sending a powerful metabolic signal that completely changes what your body does during sleep. And for people over 50, this signal is sabotaging your deep sleep in ways you can't see or feel until the damage is already done. Today, I'm going to break down exactly what's happening, why it matters more after 50, and most importantly, I'm going to give you a specific protocol you can start tonight. Not vague advice, not just education. An actual step-by-step system that hundreds of my patients have used to restore their deep sleep. But before we get to the solution, you need to understand what's actually going on inside your body right now. And I'm going to explain this in the simplest way possible. Your body operates in 2 distinct modes. Think of them like gears in a car. There's processing mode, and there's repair mode. When you eat, you shift into processing mode. Your digestive system activates. Your pancreas releases insulin to manage blood sugar. Your liver starts storing energy. Your body's entire focus is on breaking down food, absorbing nutrients, and managing the incoming fuel. Now here's the critical part. When you're in processing mode, your body cannot fully enter repair mode. It's not that repair stops completely, but it gets downgraded. It takes a back seat. And repair mode is where all the magic happens during sleep. This is when your cells clean out damaged proteins, when your brain flushes out toxins through the lymphatic system, when your tissues regenerate, when your immune system resets, when growth hormone is released to maintain muscle mass and bone density. Think about it like this. Imagine you own a restaurant. During the day, you're serving customers, cooking food, taking orders. That's processing mode. At night, after you close, that's when the deep cleaning happens. You mop the floors, you sanitize the kitchen, you take out the trash, you do repairs. You cannot do deep cleaning while customers are still coming in and ordering food. You have to close first. Your body works the same way. But if you're eating at 7, snacking at 9, eating again at 10, and going to bed at 11, you never actually close the restaurant. Your body enters sleep while still processing food. Your insulin levels are elevated. Your digestive system is active, and your cells never get the signal to enter that deep cleaning, deep repair state. Now, when you're 30, your body can handle this. Your metabolic flexibility is high. You can switch between modes easily. Your insulin sensitivity is good. Your cellular repair mechanisms are efficient. But after 50, everything changes. Your metabolic flexibility decreases, your insulin sensitivity drops, Your body takes longer to process meals, and your repair mechanisms become less efficient. This means that keeping your body in processing mode right up until sleep and throughout the night has a much bigger impact. You wake up tired because your brain didn't get its deep cleaning cycle. You wake up foggy because your neurons didn't fully repair. You wake up with low energy because your cells didn't complete their maintenance work. You're sleeping, but you're not restoring. And here's where this gets serious. This isn't just about feeling tired. Growing research indicates that chronic metabolic stress, the kind that comes from constantly elevated insulin and never giving your body a proper rest from processing food, appears directly linked to increased risk of type 2 diabetes, cardiovascular disease, and emerging evidence even suggests associations with certain cancers. The relationship works like this. When insulin levels remain chronically elevated, inflammation stays active. When cellular repair processes are repeatedly interrupted, your body's ability to clean out damaged cells decreases. Studies have shown that extended periods without food intake activate something called autophagy. This is your cell's natural recycling system. It breaks down and removes damaged proteins, dysfunctional mitochondria, and potentially cancerous cells. This process operates most efficiently when you're not constantly processing food. Research also shows that giving your digestive system regular breaks reduces inflammatory markers in the body. Lower inflammation means better cardiovascular health, better brain function, and lower disease risk across the board. As a physician watching patient health trends for over 20 years, I can tell you that patients who've modified their evening eating patterns consistently report improvements in sleep quality, morning energy, and overall well-being. Their lab work reflects these changes too. Better fasting glucose, improved cholesterol ratios, reduced inflammatory markers, lower blood pressure. These aren't isolated cases. This is a pattern I've documented across hundreds of patient interactions. Let me tell you about one patient who perfectly illustrates this. Margaret came to see me at 62. She was desperate. She told me she hadn't slept well in 5 years. She'd tried everything. New mattress, melatonin, prescription sleep medications, meditation apps, you name it. Nothing worked. She would sleep 7 hours but wake up feeling like she'd been hit by a truck. Her energy was gone by noon. Her brain fog was so bad she was worried about early dementia. I asked her my standard question. Walk me through everything you eat from dinner until bedtime. She said, well, I have dinner with my husband around 7:30. We eat healthy, lots of vegetables, lean protein, whole grains. Then around 9, I usually have some Greek yogurt because I read that protein before bed helps you sleep. Then I watch the news and usually have some whole grain crackers with a little cheese around at 10. Sometimes an apple right before bed at 11 because I don't want to go to bed hungry. I looked at her and said, Margaret, you're eating healthy foods, but you're eating them at the worst possible times. Your body never gets a break. You're keeping yourself in processing mode from 7:30 at night all the way through your sleep until breakfast the next morning. Your cells never enter repair mode. Here's what I told her to do. And this is the same protocol I'm going to share with you. I call it the metabolic reset protocol. It has 3 simple boundaries. Boundary number 1, finish your last meal or snack by 7 p.m. Not start eating at 7. Finish by 7. This gives your body a full 5 hours before a typical midnight bedtime to shift out of processing mode and begin entering repair mode. Boundary number 2, after 7 p.m., water only. No calories, no food, no juice, no milk. Herbal tea is fine. Black coffee is fine if you tolerate caffeine at night, though I don't recommend it. But no calories of any kind. Boundary number 3, don't eat again until at least 7 a.m. the next morning. This creates a 12-hour window where your body can focus entirely on repair, not processing. 12 hours, that's it, not 24-hour fasts, not extreme restrictions, just 12 hours, most of which you're sleeping anyway. I told Margaret to try this for 2 weeks. She was skeptical. She said, but won't I be hungry? Won't my metabolism slow down? What if I can't sleep because I'm hungry? These are the exact concerns I hear from everyone, and I'm going to address them in a moment. But first, let me tell you what happened to Margaret. Week 1, she struggled. She felt hungry at 9 p.m. She felt restless at 10 p.m. Her body was used to that evening grazing pattern. But she stuck with it. She drank herbal tea, she read books, she distracted herself. Week 2, something shifted. She started sleeping more deeply. She woke up fewer times during the night. Her morning brain fog started to lift. She told me she felt like someone had turned on a light switch in her brain. By month 3, Margaret was a different person. She was waking up energized. Her mental clarity was back. She'd lost 12 pounds without trying, most of it from her midsection. Her fasting glucose dropped from 108 to 92. Her inflammatory markers, measured by C-reactive protein, cut in half. She told me, "I feel like I did in my early 50s. I didn't think that was possible." Did I cure Margaret of anything? No. Did I perform a miracle? No. What happened was simple. We gave her body the metabolic rest it needed to do its natural repair work during sleep. We reduced the constant insulin signaling. We allowed her cells to enter deep repair mode, and her body responded exactly the way healthy bodies respond when given the right conditions. Now, let me give you the complete practical framework. This is not just theory, this is a step-by-step system. The metabolic reset protocol has 3 phases: preparation, implementation, and optimization. Phase 1, preparation. This is what you do today, before you even start. First, write down your current eating pattern for the last 3 days. What time was your last food? Be honest. Most people are shocked when they see it written down. Second, talk to your doctor if you're on any medications, especially diabetes medications, blood pressure medications, or if you have any chronic health conditions. This is not optional. Third, set your boundaries. Decide your cutoff time. For most people, 7 p.m. works well. But if you eat dinner later, adjust accordingly. The key is 12 hours between last food and first food. Phase 2, implementation. This is how you actually do it. Night 1, finish your last meal by your cutoff time. Let's say 7 p.m. After that, water only. When you feel hungry at 9 p.m., and you will, drink a large glass of water. Wait 10 minutes. Often, what we interpret as hunger is actually thirst or habit. If you're still genuinely hungry, have herbal tea. Peppermint, chamomile, whatever you enjoy. The warmth and ritual of tea often satisfies the psychological need for something in your mouth. At 10 p.m., when you feel restless because you usually snack while watching TV, change the pattern. Go for a short walk. Do some light stretching. Read a book. Break the habit loop. Your body isn't actually hungry, it's just used to eating at this time. If you wake up at 2 a.m. and feel hungry, this is normal for the first few nights. Your body is adjusting. Drink water, use the bathroom, go back to bed, do not eat. Within 3 to 5 nights, this stops happening. Morning 1, wait until at least 7 a.m. to eat. When you do eat, don't overcompensate. Don't eat twice as much. Eat your normal breakfast. Your body will adjust. Phase 3, optimization. After 2 weeks, you'll notice the difference. Your sleep will be deeper. Your morning energy will improve. Your mind will be clearer. At this point, you can fine-tune. Some people find they do better with a 13 or 14-hour window. Some people prefer finishing dinner by 6 p.m. Experiment. Find what works for your schedule and your body. Now let me address the 3 biggest concerns I hear every single time I explain this protocol. Concern number 1. Won't my metabolism slow down if I'm not eating frequently? This is a myth. A persistent, widespread myth. Your metabolic rate, the rate at which your body burns calories at rest, is determined primarily by your muscle mass, your activity level, and your hormonal environment. Going 12 hours without food, especially while you're sleeping for most of it, does not slow your metabolism. In fact, research suggests the opposite. When you're not constantly processing food, when insulin levels drop, your body becomes more efficient at accessing stored fat for energy. This can actually improve metabolic health. Concern number 2. Won't I lose muscle mass? No. Your body is remarkably good at preserving muscle tissue as long as you're getting adequate protein over the course of the day. and your soul, maintaining some level of physical activity. A 12-hour overnight window is not going to cause muscle wasting. What causes muscle loss is chronic inactivity, inadequate overall protein intake, and certain disease states, not a 12-hour overnight fast. Concern number 3. What if I have blood sugar crashes? If you feel shaky or lightheaded after not eating for just a few hours, this is actually a sign of poor metabolic flexibility. It means your body has become dependent on constant food intake to maintain blood sugar because it's not efficiently accessing stored energy. This is common, especially in people who've been grazing all day and evening for years. The good news is that metabolic flexibility improves with practice. When you give your body time to adapt, when you allow it to practice switching between fed and fasted states, it gets better at maintaining stable blood sugar. Within 2 to 3 weeks, most people find they no longer feel shaky or hungry during their fasting window. However, if you have diabetes, if you're on medications that affect blood sugar, this process must be medically supervised. Your medication doses may need to be adjusted. Do not attempt this without your doctor's guidance. Now let me address who should not do this protocol, at least not without close medical supervision. If you have type 1 diabetes or type 2 diabetes on insulin, you need medical supervision. Your insulin doses are calculated based on your eating patterns. If you have a history of eating disorders, this approach may not be appropriate for you. The focus on eating windows could trigger disordered patterns. If you're pregnant or breastfeeding, your nutritional needs are different and more frequent eating is necessary. If you're undergoing active cancer treatment, your doctor needs to guide your nutritional approach. If you have severe heart disease or you've had recent cardiac events, check with your cardiologist first. For everyone else, this is generally safe, but the golden rule is this. Any significant change to your eating pattern should be discussed with a physician who knows your medical history and your medications. Let me also bust 3 common myths I hear about this approach. Myth number 1, fasting makes you cold and tired. Actually, the opposite is true for most people. When your body adapts to using stored fat for energy during the fasting window, many people report feeling warmer and more energized. The fatigue people feel is usually in the first 3 to 5 days while the body is adapting. After that, energy typically improves. Myth number 2, you need to eat every few hours to maintain stable blood sugar. This is only true if you have poor metabolic flexibility. For healthy individuals, blood sugar remains stable during fasting periods because the liver releases stored glucose as needed. The more you practice fasting windows, the better your body gets at this. Myth number 3, you'll be so hungry in Sansi, the morning you'll overeat. Research shows this doesn't happen. When people break their fast after 12 to 14 hours, they typically eat a normal-sized meal, not double portions. Hunger hormones normalize during the fasting window. Now let me tell you why this information isn't discussed more often in conventional medical appointments. The truth is, most doctors are operating within a system that allows about 15 minutes per patient. We're trained to diagnose disease and prescribe treatment. We're excellent at managing acute problems. But we don't always have the time or the framework to have detailed conversations about metabolic health, eating timing, and preventive strategies that don't involve prescription medications. Additionally, nutritional education in medical school has historically been limited. We learned biochemistry. We learned about disease states. But we didn't always learn how to apply metabolic science to practical lifestyle recommendations. That's changing now as more research emerges about metabolic health. But it's not yet standard practice in many clinics. There's no conspiracy here. It's simply a limitation of how our healthcare system is structured. It's built around acute care and disease management, not around optimizing metabolic function for disease prevention. So what are the practical next steps? Here's your evening wind-down protocol. This is what you actually do starting tonight. 2 hours before bed, that's your last bite of food. For most people, this is around 8 or 9 p.m. if you go to bed at 10 or 11. Finish dinner, clear the dishes, and you're done eating for the day. 1 hour before bed, this is your transition time. Make yourself some herbal tea. Peppermint, chamomile, whatever you enjoy. The ritual matters. You're replacing the snacking ritual with a tea ritual. Sit down, sip slowly. This signals to your body that the eating day is over. 30 minutes before bed, do some light activity. Short walk around your house or yard. Some gentle stretching, maybe 5 minutes of deep breathing. This helps with digestion and signals your body that sleep is approaching. At bedtime, if you feel hungry, remind yourself that this is habit, not actual hunger. You ate dinner 2 hours ago. Your body has plenty of stored energy. Drink some water, get in bed. The feeling will pass within 10 to 15 minutes. If you wake up at night and feel hungry, same thing. Water, bathroom, back to bed. Do not eat. This pattern breaks within a few nights. Let me give you a realistic timeline of what to expect. Week 1, you'll feel the adjustment. Hunger at your usual snacking times, maybe some restlessness. This is normal, your body is adapting. Push through. Week 2, things start to shift. You'll notice you're sleeping more soundly, waking up less frequently. Your morning grogginess starts to improve. Week 4, the changes become obvious. Better energy throughout the day, clearer thinking. Clothes fitting better. Week 12, this is when lab changes become visible. If you get blood work done, you'll likely see improvements in fasting glucose, cholesterol, inflammatory markers, and sometimes blood pressure. But here's the most important thing. This is not about perfection. If you have a late dinner occasionally, if you eat dessert at a party, if you break your pattern on a weekend, that's fine. We're talking about what you do most of the time, not what you do occasionally. Aim for consistency 5 to 6 nights per week. That's enough to get results. Your body is remarkably resilient. Even if you've been eating late into the evening for years, even if you're over 50 and you think it's too late to make a difference, your body can adapt. It may take a few weeks. You might feel challenged initially. But in my experience, most patients who stick with this protocol for 1 month report significant improvements in sleep quality and energy. The deep sleep you're missing, that restorative sleep that helps you wake up feeling truly refreshed, that's not gone forever. It's still accessible. But it requires creating the right metabolic environment for it to happen. And a significant part of that environment is giving your body the processing break it needs to focus on repair during sleep. I think about health in terms of patterns, not perfection. The choices you make consistently over weeks and months are what shape your health trajectory. No single meal, no single evening will make or break your health. But the pattern you establish, the signals you send your body day after day, those accumulate, those matter. If you're over 50 and you're struggling with sleep quality, if you're waking up tired despite sleeping enough hours, if your energy isn't what you'd like it to be, I strongly encourage you to try this protocol. Not with the expectation of miracles, but with the understanding that your body wants to function well. It wants to repair itself. It wants to give you deep restorative sleep. You just need to create the conditions that allow it to do so. So here's my challenge to you. Try the metabolic reset protocol for 2 weeks. Just 2 weeks. Finish eating by 7 p.m. Water only after that. Don't eat again until 7 a.m. Track how you feel. Track your sleep quality. Track your energy levels. See what happens. In my next video, I'm going to talk about the morning side of this equation. What you eat for breakfast and when you eat it has a massive impact on your metabolic health and your energy throughout the day. There are specific mistakes people over 50 make with breakfast that sabotage everything we've talked about today. I'm going to show you exactly how to optimize your morning routine to complement this evening protocol. If you found this information valuable, please hit that like button. It helps this video reach other people over 50 who are struggling with sleep and energy just like you. And subscribe to the channel. I'm creating practical, research-based content that gives you actual protocols, not just general advice. Thank you for spending this time with me today. Remember, small changes, applied consistently, create meaningful results. Your body is capable of remarkable restoration when you give it the right conditions. Start tonight. Stop eating by 7 p.m. See how you feel in 2 weeks. I think you're going to be surprised at the difference. I'll see you in the next video.